buscarse sin encontrarse. Me encierran los muros de todas partes. Barcelona, te estás equivocando. No puedes seguir inventando que el mundo sea otra cosa.
Patient name. Patient name.
Tired grunts and moans.
List of detailed questions about your symptoms.
Answers to questions. Express concern about an unrelated problem.
Pretend to write down problem to appease you. Verbal assurance that it'll be looked into. Question whether there's anything else I can get you to demonstrate empathy.
Joke about the hot nurse that worked with me last night. Question about when I'm going to be able to eat.
Uncomfortable laughter at your sexism. Reminder that you're still in PO.
Joke about how nice it is to sleep in as an attending.
Over-enthusiastic laugh.
Plan for the day.
Overly formal soap note presentation with too much useless information.
Ask question about something you just stated, clearly showing I wasn't paying attention.
Answer question, pretending I didn't tell you the answer literally 5 seconds ago.
Compliment presentation. Ask about plan.
Proposed plan that's completely wrong for the patient.
Interrupt med student with correct plan so as to keep rounds moving efficiently.
Enter wrap-up presentation and move into patient room.
Interject to remind everyone about the EBM I prepared for today.
Rolls eyes as med student begins presenting EBM.
Comment that I remember when that study first came out.
Introduce Mr. Patient to everyone in the room. Ask Mr. Patient to briefly say why he's here.
Give completely revised history of present illness with different symptoms.
Pretend to listen to patient's heart and lungs for a total of 1 second. Ask student if he appreciated the obscure physical exam finding.
Lie that I appreciated that obscure physical exam finding.
Jest that pimping just isn't what it used to be.
Reminisce about how different it was when I was a med student.
Pimp student intensely about obscure, non-evidence-based topic.
Flail arms in attempt to charade correct answer to med student.
Misinterpret intern charading. Give wrong answer.
Tangential rant about the cost of healthcare.
Nod and squint to demonstrate understanding and concern for the future of healthcare.
Again, attempt to keep rounds moving on. Explain that next patient is an outside hospital transfer.
Denigrating comment about outside hospital.
Insult outside hospital.
Comment about outside hospital's inability to perform and interpret a basic lab test.
Suggest repetition of outside hospital's PAN scan.
Genuine question about outside hospital's choice of antibiotics.
Sarcastic comment about outside hospital's choice of antibiotics.
Misinterpret sarcasm.
Mr. Patient is an age with a history and now has problems. Problems began in the past. Problems are multiple and they are troubling. Mr. Patient also has a body and you can see his problems on his body.
Explain that I attempted to block this admission and express frustration with the ED for admitting this patient.
Exasperation with ED.
Question about the plan for the patient.
Explain that randomized controlled trials have shown that drug good is better than drug bad. However, clarification that we should continue to use drug bad because it is the accepted practice.
Suggestion of new drug approach, only to realize that attending and resident were talking about the same drug, only in the brand name.
Compliment your note that I had clearly never looked at.
Expression of gratitude.
Attempt to enthuse you about tomorrow's call day.
Feign enthusiasm.
Question you about your undergrad, your hometown, what you're planning on going into. See if there's any questions you might have.
Express uncertainty about my decision, but strongly suggest that I really like this specialty. Stare hopelessly at the number of incorrect questions on UWorld. Count down the number of days until a shelf exam.